Greetings, Madam Nazorina and everyone. I am Melissa from OUM Kuching, Sarawak. Allow me to introduce myself. My student ID number is 800114135014-001, semester January 2026, with the program Bachelor of Nursing Science with Honours. And now, I want to present my topic for nursing subject NBBS3303 Communication and Counseling Skill for Nurses. The goal of this presentation is to connect therapeutic communication theory to everyday clinical practice, to identify how specific counseling skills prevent medical errors of patient safety, and to provide techniques to encourage patients to take an active role in their own recovery for follow-through treatment. Maintaining a therapeutic relationship in counseling or clinical settings is very important because it helps patients to feel safe, respected, and supported. When patients trust healthcare professionals, they are more open to discussing their fears and concerns. What are the criteria that we need? Number 1, trust and confidentiality. Trust is the foundation of a therapeutic relationship. Patients need to feel safe when sharing their worries, especially when facing a major decision. For example, a patient refused to undergo a below-knee amputation surgery because he doesn't want to live with only one leg. This is a very emotional and life-changing decision. The patient may feel fear, sadness, anger, or denial. To maintain trust in this situation, we must acknowledge the patient's feeling. We can say, I understand that this is a very difficult decision for you. Then we must reassure confidentiality. Everything that you share with us will remain confidential. Then we must provide clear and honest information. Explain the medical reasons for the amputation and the risk of not proceeding, such as infection spreading or life-threatening complication. Allow time and space by giving the patient time to process the information and ask questions. By building trust and maintaining confidentiality, the patient is more likely to open up their fears. This helps healthcare professionals support him emotionally and guide him toward informed consent. For criteria number 2, you must have empathy and compassion. Empathy and compassion are very important, especially when the patient is facing a life-changing decision. The patient who refuses a below-knee amputation may feel fear, sadness, anger, or even denial. If healthcare professionals do not show understanding, the patient may feel pressured, misunderstood, or isolated. To apply it in this case, we must acknowledge the patient's feelings. For example, by saying, I understand that losing a leg is a very big challenge, and it is normal to feel scared. And then, we must listen actively. Allow the patient to express fears such as body image concerns, mobility issues, or fear of depending on others. And then show the genuine concern, maintain a calm tone, sit at the eye level, and avoid rushing the conversation. Adjust your approach. If a patient is very emotional, speak gently and give them time. If they are angry, remain calm and avoid arguing. By showing empathy and compassion, the patient feels respected and understood. This helps build trust and may encourage the patient to consider the surgery more openly once the risks and benefits are fully understood. Criteria number 3, unconditional positive regard. Unconditional positive regard means accepting the patient without judging them. It helps the patient feel respected and valued, even if they are made decisions that we may not agree with. When patients feel accepted, they are more likely to open up and trust the healthcare team. For example, If a patient refuses a below-knee amputation because they do not want to live with one leg, healthcare professionals should not criticize or pressure them. Instead of saying, you have no choice, you must do the surgery, what we can say is, I respect your feelings and understand this is a very difficult decision for you. We should avoid imposing our personal belief and instead support the patient in understanding the risk and benefit clearly. Even if their decision is different from what we expect, we continue to provide care, support, and information. By practicing unconditional positive regard, the patient feels accepted rather than be judged. This strengthens the therapeutic relationship and encourage better communication and cooperation. Criteria number 4, flexibility and adaptability. A patient's emotion and decision can change over time, especially in serious cases like below-knee amputation. The patient may first refuse the surgery due to the fear, but later become more open after understanding the risk. Healthcare professionals must be flexible and adjust the approach according to the patient's emotional state and readiness. In this case, regularly reassess the patient's understanding and decision. For example, after our discussion, how are you feeling about the surgery now? Be open to feedback. If the patient says they need more time or want family involvement, respect that and adjust the plan. Tailor the explanation according to the patient needs. Some patients prefer detailed medical explanations, while others prefer simple and clear information. Being flexible helps the patient feel supported rather than pressured. Criteria number 5. Provide clear communications. Clear communications prevent misunderstanding and confusion. In serious procedures like amputation, an unclear explanation may increase the fear and refusal. How to apply it in this case? Explain clearly why the surgeon is needed and what may happen if it is not done. Use simple language instead of medical terms. And then summarize the discussion. For example, just to summarize, the infection is spreading and without surgery, it may become life-threatening. Encourage the patients to ask questions and clarify doubts. For example, is there anything you would like me to explain again? And then set a clear boundaries by remaining respectful. For example, we respect your decision, but we also need to inform you about the risk involved. Clear communication helps the patients make an informed decision and improve safety and trust. Criteria number 6, goal alignment and collaboration. Setting goals together help the patients and the healthcare team work towards the same outcome. When patients feel involved in decision making, they are more likely to trust the treatment plan and follow the medical advice. In this case, or the scenario below-knee amputation, involve the patient in discussing the treatment goals. For example, the goal may be to prevent the infection, save the patient's life, and help them regain mobility in rehabilitation later. Regularly discuss the patient concern and progress. For instance, the nurse can ask, what are your biggest worries about the surgery? And address them together. And then adjust the plan based on the patient needs. If the patient is worried about losing the mobility, the healthcare team can explain prosthetic option and rehabilitation to help the patient feel more hopeful about life after surgery. By working together and agreeing on the goals, the patient may feel more supported and confident in making decisions about the treatment. Criteria number 7, continuity of care. Consistent care helps build trust between the patient and the healthcare team. When patients see the same support and communication throughout their treatment, they feel more comfortable and confident. In this case, with the patient refusing the below-knee amputation, maintain regular communication with the patient to check on their feelings and concern about the surgery. If there are any changes in the treatment plan, explain to them clearly to avoid confusion. Provide follow-up discussion or counseling sessions to help the patient slowly understand the importance of the surgery and feel supported in making the decision. Emotional presence for criteria number 8. Being emotionally present helps the patient feel supported and understood. This can strengthen the trust between the patient and the healthcare team. For example, in this case, for patient refusing the below-knee amputation, give full attention when the patient is sharing their fears about losing a leg. Show understanding through supportive response, such as acknowledging that it is normal to feel scared or worried, and avoid distraction and focus on listening carefully to the patient's concern so they feel heard and respected. Respect for autonomy. For criteria number 9, patients have the right to make decisions about their own health. Respecting their choice help them feel in control of their treatment. In this case, we must encourage the patient to express their thoughts and concern about the surgery. Provide clear information about the benefits and risks, but do not force the decision. Give the patient time to think and decide on their own time while continuing to support them. Criteria number 10. Addressing misunderstandings in the relationship. If misunderstandings or conflicts are ignored, it can weaken the trust between the healthcare provider and the patient. In this case, if the patients feel upset or misunderstood, address the issue calmly and respectfully. Ask for the patient's feedback and listen to their concern about the surgery. Reassure the patient that the healthcare team is there to support them and work together to find the best solution. Cultural sensitivity and competence. For criteria number 11, patients may have different cultural beliefs about illness, surgery, or disability. Respecting this belief helps build trust and better communication. In this case, try to understand the patient's cultural belief about losing a limb or undergoing surgery. Avoid making assumptions about their decision. Explain the treatment in a way that respects their cultural values while helping them understand the medical importance of the procedure. Self-awareness and professional reflection. Healthcare providers need to be aware of their own feelings, opinions, or biases so they can remain professional when caring for patients. In this case, the nurse or counselor should reflect on their own reactions if they feel frustrated when the patient refuses the surgery. Discuss the situation with colleagues or supervisors to get support and better ideas on how to approach the patient. And continue learning and improving communication skills to provide better patient care. For evidence-based and ethical practice, using proper medical knowledge and following ethical principles helps build patient trust and ensure safe treatment. Explain to the patient using clear medical evidence why the amputation may be necessary to prevent infection or life-threatening complications. Provide honest information about the benefits and risks of the surgery, such as the infection spreading if the amputation is not done, and also explain the alternative and support available. including the use of a prosthetic leg and rehabilitation with the occupational therapist to help the patient regain mobility and perform daily activities. Respect the patient decision while maintaining professional and ethical boundaries. For patience and persistence, sometimes patients need time to accept the situation and make important decisions. Healthcare providers must be patient and supportive during this process. The nurse should give the patient enough time to think about the surgery instead of forcing a quick decision. In this scenario again, continue to explain the benefit of the surgery and the risk of delaying treatment. Encourage the patient and reassure them that the healthcare team will support them throughout the treatment and recovery process. A strong counselor-client relationship is a key to successful counseling. Here are some of the key elements that build it. Explain simply. Number 1, trust. Clients must feel safe and at ease to openly share their thoughts, feelings, and stories without worrying about others. Be reliable, keep their info private, and show real concern for them. Empathy. It makes clients feel truly understood and cared for, helping them open up more. Listen actively, get their emotions, and view things from their perspective. Unconditional positive regard. Patient feels valued and respected without judgment, making it easier for them to share their true feelings. Avoid criticism, offer steady support, and honor them as individuals. Genuineness. Active, real, and honest create an authentic bond that strengthens the trust. Be straightforward and open while keeping things professional. Active listening. Patient opens up more when they know you are fully hearing them. Pay close attention, use body language to show focus, repeat back what they said, and ask clarifying questions. Boundaries. Why it matters is to clearly keep the session professional and safeguard both you and the client. How to set them, spell out rules, stick to session time, and steer clear of personal ties with clients. Cultural competence. Respecting a client's culture makes therapy welcoming and effective for everyone. How to apply it, honor differences, keep assumptions, and tailor your method to their background. Collaborations. Client gain ownership and confidence by joining in their own progress. How to encourage it, involve them in goal setting, strategy picks, and tracking results. Hope and encouragement. Why it matters. Giving clients hope helps them stay motivated to make positive changes. How to do it? Focus on their strength, praise their progress, and remind them that improvement is possible. Confidentiality. Why it matters. Keeping clients' information private help build trust. How to do it? Follow ethical and legal rules to protect privacy and clearly explain your confidentiality policies to clients. For conclusion, why therapeutic communication matters in healthcare? Provide patient safety, spot patient worries early, cut errors, and ensure the right care. For treatment follow-through, boost sticking to plans, build cooperation through understanding and support. For better patient experience, strengthen the trust with providers and deliver empathy for comfort during care. Overall impact, drive better outcomes as patients agree to follow the doctor's treatment plan and elevate care quality by reducing prolonged hospital stay and speeding recovery. And thank you for watching my presentation.